My name is Emily Covington. I'm the admissions counselor for the nursing programs through the University of Alabama Online, and I'll be hosting our session today. And I just wanted to thank everybody for joining us. This is going to be a live Q&A session to answer any questions that you all may have on our Doctor of Nursing Practice program. We also have several faculty and staff members here today that are going to be here to answer your questions and kind of talk to you about the program. Vickie is going to kind of give you guys an overview of, what the program entails and everything after we do introductions. So if you each want to introduce yourself, Vickie, if you want to go first, and just tell us a little bit about yourself and your role within the College of Nursing.
Okay, I'm Vickie Samuel. I'm the coordinator of Graduate Student Services. I do the recruiting and the advising for all of the graduate programs. I'm actually going to introduce Dr. Amy Lee. She's the coordinator for the program. Dr. Lee, would you like to do the overview?
I'm Dr. Amy Lee. I am the DNP program coordinator. What were you thinking, Vickie, as far as what did you want me to include?
I can't hear you.
Oh, can you hear me at all? Hello? Emily, can you hear me?
Okay, well, while Dr. Lee gets the audio and hers straightened out, I'll go to our DNP program. We have it in two different tracks. We can do the BSN to DNP, so those are for post-baccalaureate students who want to go straight on to a doctorate, and they have four tracks that they can follow under the BSN to DNP. You can do the nurse practitioner, which is family and psychiatric mental health, and you can do the dual track. We also have the nurse administrator track for the BSN to DNP. Those programs can be done in approximately 3 to 4 years. We also have the postmaster's DNP, which is a leadership emphasis. That program can be done in between 5 semesters and 8 semesters, depending on what semester you come into the program and whether you go full-time. Dr. Lee?
Can you hear me now?
We can hear you now.
Oh, fabulous. I don't know. I had my AirPods in, so maybe it was prohibiting me from speaking. So I'm sorry. I'm Dr. Amy Lee. I am the DNP program coordinator, and as Ms. Samuels was saying, we have several different options for the program, the BSN to DNP programs, and you can, and that is the family nurse practitioner track, the psych mental health nurse practitioner track, and then the dual psych mental health family nurse practitioner track, and as well as a nurse admin track for those who have bachelor's of nursing and would like to progress through to the DNP. But we also have a very vital post-MSN DNP program that is a DNP for anyone who has a master's in nursing or in some cases nurses who have masters in other fields, and that would be on a case-by-case basis. And that program is a standard program to achieve the DNP. And if you have, and really where your specialty comes up is during the project focus of your program. And so, but there is options within that program if you'd like to take some elective courses to really increase your focus in an area. But so there are a lot of options for how to achieve the DNP depending on where you are in life and in your career. Vickie, what else did you want me to cover?
I think maybe we can just answer the questions that the participants have, and I think that will cover a lot of the program itself.
Yeah, so if you all want to include your questions into the chat box, I will read them out to our faculty and staff members that are here to answer questions for you. So I'm going to give you all just a moment to include any questions that you have. While we are, waiting for some of our participants to enter questions, I'll go ahead and ask a few frequently asked questions about the program, just to give us, some information while our participants are thinking of some questions that they might have. As far as campus requirements, are students required to attend campus for any reason for this program, and if so, how often?
Yes, the student. Go ahead, Dr. Lee.
I was going to say, so we do have a DNP intensive that the student is required to attend once during the program of study, and that is required during the final 3 semesters of study. However, it's every year we have that DNP intensive. It's a day and a half of really great educational topics and speakers, and a student is eligible to attend that every year. However, they're required to attend during those last 3 semesters of their program of study. And of course, we always encourage students to come back for graduation. Vickie, did you have any other thoughts on that?
No, we do have a virtual orientation that is required to attend, and that's usually the first day of class, but that's virtual.
Great, thank y'all so much. And as far as like how many times total would that be that like if a student lived, in a state that's far away and needed to buy plane tickets, how many times would they need to visit campus for those final 3 semesters?
So technically required only once. Encouraged to come for graduation though, because that is a truly very unique experience that we would just encourage everyone to have.
Okay, perfect. Thank you so much. And again, feel free to include your questions in the chat as we go. And if you have recently joined us, we are just going through frequently asked questions. So if you have anything that you would like to ask our faculty and staff members, feel free to throw that in the chat for us as well. So as far as an admissions decision, how does the process work after a student puts in an application? About how long does it take to do the decision, and then what can they expect after they press submit?
Once they apply to the grad school, they have several documents to upload into that application. Once their application is complete, they'll receive an email to do an online interview through a system called Kira Talent. Once that interview is complete, faculty review, and it usually takes about 14 business days for a decision. However, during peak times when their applications are quite busy, it could take a little longer.
Thank you so much for that. We do have a question that's come into the chat. So a student wants to know, the statement of purpose asks for a potential DNP project. Is the applicant required to use this as the actual DNP project?
No, so it's exactly what it says, potential. It's just an area of interest that the student really has an interest in. We would never expect anybody to come in really having that refined, because that's the point of the program. We hope you'll have something that you're truly interested in, that you can work with throughout the program, but that interest may change, or your job may change, and your interest in your areas may change, and that's fine. And we do see that happen. You're not contracted into whatever you write in that purpose statement. It's just to get a feel for how you grasp the concepts.
Thank you so much. And if you have any, if you have any additional follow-up questions or anything, feel free to throw those in the chat as well. As far as clinical sites, can you all speak a little bit more on how those clinical sites work? Do students choose them themselves? Are they done locally to the student? Just a little more information about that for us.
So clinical sites are very different in the DNP program than they are in, say, a master's program where you're going to clinicals and you're collecting clinical hours. A clinical site is somewhere where you're doing your DNP scholarly project. So optimally, it's somewhere that you work. It's somewhere that you have access to, and somewhere where you can identify a problem that you can then implement a solution to, and study. And so, and those hours, those clinical hours, are hours that are devoted to your project, whether it's writing your project, developing your project, implementing your project, disseminating your project, those sort of things. And so those clinical hours are a very different thing than what we think of in our undergraduate or our master's levels programs, where you're just going and you're collecting hours and seeing patients. And this, you're not necessarily seeing patients. This is devoted to the project. And so it's usually the place that you work. Every now and then, though, it doesn't work out to be the place that you work. And I've had people do their clinical projects or their DNP projects at, I had one student that did it at a free clinic, a faith-based clinic where she volunteered, and that's fine as well. But it's not necessarily the same kind of concept of hours. Vickie, do you want to talk about the approval process for getting a clinical site?
Yes, and then a little bit about the BSN to DNP. The BSN to DNP students will also do their clinical within facility for whichever concentration they're following. The process is similar to all of our programs. There's clinical paperwork that's done usually 2 semesters, a semester and a half prior to starting clinical. This paperwork gets done between the student and the clinical advisor or preceptor. If we already have an agreement with these facilities, there's not a lot of that needs to be done, but if we have to work out contracts, it could take several months. So that's why we start the process so early. We do have a list of facilities that we have agreements with, that students who are having a hard time finding locations can start with those. We also can reach out to previous students to see if they're willing to precept or to be clinical advisors.
And it is, and you do bring up an interesting point about, so people who have the BSN to DNP for the track that is their, whether it's the NP track or whether it's the nurse admin track, those clinical hours will be more classic of going and seeing patients and collecting our clinical hours, and those will be with facilities and preceptors that are, have to be worked out and agreed upon. But again, if you live remotely, you don't need to come to Tuscaloosa for that. You can work out preceptors and clinical sites where you live. But once you get to the DNP level, to your doctoral level project course hours, those are very, very different in the way that I described.
Thank you so much for those answers and that explanation. I'm sure that's going to help some students a lot when they're looking into that program. I am going to go over to some of the questions that have been submitted prior to this for any students that are going to go back and watch the recording of this. We did have a question that was submitted that was asking how the courses work, if they're live classes or at a certain time. And I know our courses are asynchronous, but I did want to see if you all had anything to add to explain kind of how the coursework works when you are dealing with an online education rather than a main campus one.
I remember this being one of the most surprising things for me when I went back to get my DNP, was the way that online education worked and how different it was. The way our online courses are set up is it's set up into modules, and so each and you will have due dates and assignments, and you will have discussion boards within there that you will have questions that you will answer, and assignments that you will do and turn in that format, and you will have interactions with classmates, and in a way that you'll come out feeling like you really have spent a lot of time with your classmates, and you'll form relationships with your classmates. And so, but without ever sitting in a classroom with them, it's really amazing how different it is, but how the relationships that you will form in that format. And so, and the nice part about it is, for those of you that, you're out of college and you've got a job, you can meet it when you have time. So, So, if you are working all day, then you can do it in the evenings, or you can, catch up on the weekends and that kind of stuff. So it is really nice. You just need to make sure you hit all your deadlines on time.
Perfect. Thank you so much. We do have another question we have two questions in our chat box here. The first one, the student wants to know, is there any advice on choosing full-time versus part-time? If a student started part-time, but could they switch to full-time study or vice versa?
Students I always tell students, you can anticipate anywhere from 9 to 12 hours per course of coursework each week. So, it's hard for us to answer whether you can do full-time or part-time. It is feasible. We have quite a few students who do full-time. You just have to have the support at home, at work. You have to have that flexibility to do that. It could take quite a bit of, of your week to do classwork. Write papers, especially when you get to your project. There's a lot of lit review. There's a lot to be done with those projects. So you can choose full-time. Most of our courses now are taught multiple times a year, so we can revise plans of study. If you get in part-time and feel that you can handle full-time, we can. There are several courses that have prereqs, so it may not be full-time every semester based on when the courses are offered. But we'll work with students as much as we can.
But you would say, Vickie, it's pretty easy to switch. If you're full-time and you find that it's too much, you can easily move to part-time.
All right, we have one more question in the chat box. If you were to complete an application this week, or a student were to, could they be accommodated for the spring semester?
Yes, as long as the application is already in for this spring, then we'll work with you to finish it and review it for spring.
But Vickie, if it hasn't been submitted at this point,
if it has not been submitted yet, then we're not accepting spring applications, no. We're only working with the ones that are already in the system.
What is the deadline for summer, Vickie?
December 1st. It's December 1st for summer and March 1st for fall. And those two, summer and fall, are both open to apply right now.
All right, thank you so much. Again, students, if you have any additional questions for our faculty and staff members, if any of our participants have questions, feel free to throw those in the chat box, or any follow-up questions on anything that we have previously discussed. I'm going to go back to some of the questions that were submitted prior to, for anyone watching the recording. We had several students ask about the tuition for the program. I can speak on that, or if you all would like to speak on that, you're welcome to do so as well. We do not charge, as far as our UA online coursework, we do not charge out-of-state tuition, which is, a good plus for some students that may be out of state. So the tuition per hour is $440, and you would just need to make sure to include any college fees or any other, book fees or anything in that when you are calculating that. So you would take the number of credit hours required for the program and multiply that by the tuition per credit hour. It looks like we have another question in the chat. How many required clinical hours are needed for the DNP leadership track?
So for the post-MSN, it would just be a DNP, and then the project hours would be devoted to a leadership project, and those would be it's 3 project courses, and it's 180 clinical hours per course. So 3 times 180 is like 540. Is that right? Yes.
That's 540. Correct.
For the BSN to DNP, then it's twice that, because the 3 leadership courses require 180 clinical hours each, and then the project hours are 180 clinical hours each.
Yeah, there's 1,080 clinical hours in a BSN to DNP program, 540 for the the nurse practitioner or the nurse administrator, and then the 540 for the DNP.
Right.
Perfect. Thank you so much. I'm going to go ahead and ask another question that was submitted prior. As far as eligibility requirements, what is required to be admitted to the program? And then also, if students live in a different state and they're trying to figure out if they're eligible based on their licensure and residency, how would they figure that out?
Well, students must have a 3.0 overall or the last 60 hours to qualify. BSN to DNP students, there are 7 states that we accept from right now. And this is due to boards of nursing state authorization. There are some advanced practice states have regulations on their advanced practice programs and doing clinical within that state. So we do have some regulations there. It's Alabama, Florida, Georgia, Mississippi, Virginia, North Carolina, South Carolina, and Texas, 8 states. Those are the states that we accept from right now for the BSN to DNP, and that's because of the nurse practitioner pieces. Now, the nurse administrator, there have the same regulations as the MSN for the nurse administrator and for the DNP, and there's only a handful of states that we can't accept for the DNP, for the postmasters DNP, and those are Washington and Colorado. I know right off the top of my head are 2, and I think Minnesota is the other one. And as far as, we require, there's a statement of purpose that have guidelines and then very specific questions to answer, 2 recommendation letters, and we recommend for a faculty member or an employer, personal references, or we ask to kind of shy away from those, a resume and a copy of your RN license.
All right, thank you so much for that explanation, Vickie. And if you all have anything else you think would be useful or helpful for our participants to know about the program, feel free to go ahead and speak on that. I am out of questions right now, so if y'all think of anything else before we conclude that you think would be useful or that they would just need to know about the process, feel free to jump in.
I think one of the greatest benefits is that Ms. Samuel will work with you and walk you through the process from beginning to end.
And just to know that we do, of course, there are courses that have prereqs and we, need to be taken in order, but we do have some flexibility. We do understand that we're adult students. Life sometimes gets in a way, so we do have some flexibility with the program. If you have to take a leave of absence, we would much rather you do that than to register and do poorly in a course. So just communication, we try to keep those open lines between us so that we can make this experience the best possible.
All right, thank you all so much for attending and answering questions for our participants today. We really appreciate you doing this Q&A session with us, just to give them a good idea of the answering their questions about the program and the program requirements, and kind of getting to know the ins and outs of the program. As we do have some information for each of our faculty and staff members here today. If you have any additional questions after this and you would like to reach out to them, Vickie, I'm sure would be happy to answer your questions. You can also email me if you have questions as well. But I just wanted to thank everyone for attending. And again, any follow-up questions, feel free to reach out to us on the information there on the screen. And also, other good resources are to visit the College of Nursing website or our UA online website and select the nursing degree programs. And both of those are very good wealth of information for you to find information about your program if you have anything that we didn't cover today. But yeah, thank you so much everyone for attending and have a great rest of your day.